Well, I am so happy to be here today to talk more about a disease state that's near and dear to my heart. And Leanne, it's wonderful to have you with us. And I know this is a topic that you're passionate about as well in your clinic, which is vitiligo. And as we approach the era of so many new exciting treatments, one thing that I always say is that you and I and all of the clinicians who treat these patients are key in providing hope and inspiration to patients that there are new treatments on the horizon. And I kind of wanted to get your sense about, when you talk about new treatments or when you talk about how to approach vitiligo, what are some of the things that have really helped you build that rapport with your patients?
That's a really good question. You're right. It is getting easier to talk to patients with vitiligo about what we currently have, and certainly the buzz is starting for what we're about to have. And so, in terms of current expectations, we currently have one FDA approved topical therapy, and that is ruxolitinib cream. It is meant to be used twice a day, and in the vitiligo space, it's meant to be used on 10% of the body or less. And so I say that to all of you clinicians out there just to remind you, make sure that you're documenting at minimum that you're using it on 10% or less.
I totally agree with that. Leanne, I'm so glad you mentioned that. And I know I want you to keep talking, but that is such an important point because the studies were done in 10% or less, ages 12 and above. But hopefully, we're going to get more and more data in the next few years. And who knows, that may change.
You're so right. I think in terms of just setting realistic expectations, I find the best way to do that is to really know my data. And so when it comes to ruxolitinib cream, I like to use the data to really help define what is it that we're looking for. And that conversation goes a little like this. Ruxolitinib cream, it's a Janus kinase inhibitor, which is just a type of topical medicine. And in the clinical studies for this cream, it was used twice a day on those depigmented or white patches. And really, the expectation, because it's a topical therapy, it's going to take a little bit more time. And
Yes.
we really need to give this a good 24 weeks, which is 6 months of twice a day, every day, before we assess, is this medicine working? And so I then like to say, okay, if today is February 12th, which it's not, but if it was, let's fast forward and let's go 6 months from today, which is August 12th. And that's the day that I'm going to do my best to see you back in clinic. And then you and I, we're going to take some photos today of those white depigmented patches. And then you and I are going to look on that day for improvement. And the improvement that we're going to look for is going to be certainly looking at that peripheral border where the vitiligo starts and where it stops. Right now, it is so evident. But when I see you in 6 months, what I hope to see is that hazing of the border, where it's really hard to tell where does it start and where does it stop. And the second thing is looking for the lovely perifollicular repigmentation, right from that bulge of the hair follicle. We want to see little freckles, little chocolate chips of repigmentation. And we're going to get super excited about both of those things with this cream.
I love that. And I love how you made it practical and real. And actually, to be honest, you and I are in different clinics and we've never been in the same clinic together, but I explain it very, very similarly. Almost everything you said, not only is it correct and factual, but it's also very digestible to the patient because these are very overwhelming visits. The one thing that I really, if I had to pick one thing that I love the most about what you said, is that treating vitiligo takes time. Nothing that we do in the world of vitiligo is a quick fix. It is not like treating eczema and putting out the itch in a couple of days. It is not like treating psoriasis and getting rid of the scales in a couple of weeks. It's not like treating acne and reducing those papules and pustules. It takes time. And so for any of you who are listening to Leanne and I today, if you leave with nothing, please do not bring these patients back in a month and tell them, oh, you're no better. It's not going to work. Unfortunately, I've seen that happen, and it leads to mistrust. It leads to fear and anxiety for these patients because they feel like, oh, it didn't work. And a lot of patients who come to see me just haven't been dosed correctly, dosed long enough, haven't been counseled like you did. So I love what you said. And I think that helps us segue to kind of the last thing I really wanted. I mean, there's so much we can talk about. We could talk about this for hours, but the last thing I really want to focus on is the need for more understanding that vitiligo is an autoimmune medical disease. And I wanted to kind of get your take on how you navigated that with your patients.
Yeah, I think again back to the education. I think you and I are aligned, but I would
Yeah.
say World Vitiligo Day is coming up June the 20th
Yes.
every year. And, I really, really think that this is an opportunity for us as dermatology providers to really get on the World Vitiligo Day celebration with our patients to call attention to it, maybe with some signage and just understanding for our patients who suffer from this disease. And then I want to say I am super excited as I look to the future, not only about what will be approved, hopefully soon in our treatment armamentarium, but also looking at combination treatments is
Oh,
very.
yes. I love that. And hopefully you and I'll get to do more of this together. But thank you for plugging World Vitiligo Day. I did not ask you to plug it. You did that. And I'm so proud and happy you did, because as president of the Global Vitiligo Foundation, which is the largest international organization dedicated to vitiligo, obviously World Vitiligo Day is near and dear to my heart. For any of you listening, clinicians listening, go to the Global Vitiligo Foundation webpage. Lots of free resources for us who are treating patients. But if you have patients, send them, like Leanne said, to learn about World Vitiligo Day. It's a fantastic conference every June. This year, it'll be in June in Charlotte. Incredible opportunity to make lifelong connections and friends, meet with researchers and doctors and clinicians and industry and so many more who we're all on the same quest to one day find a cure. So, Leanne, I can't thank you enough for plugging that. And I just want to say thank you for being so conscientious and caring for your vitiligo patients, which I hope all of us in our busy, busy clinic lives, which I know are always challenging days, but can take a few extra minutes to really give these patients hope. So I just want to say thank you. And I look forward to continuing our conversations in a future segment. And I look forward to seeing you soon.
Absolutely. Have a great day, Dr. Desai.
You too. Thank you, Leanne.